You guys ready for this? Because I don't know if I'm ready for this. I know y'all are ready for this. Hey everybody, welcome back. If you're new here, my name is Hannah. I'm an IFBB Pro female bodybuilder, and I've created this channel to talk about my experiences with PEDs and all things bodybuilding. So if that interests you, stick around. We have a very big video today, my full history of PED use. In this video, I'm only going to be covering my PED cycles. I'm not going to go into details of my life. I will be making a separate video because a lot of you guys were curious as to why I wanted to be hypermuscular, and I will be making a separate video for that. That one's going to be a little bit harder emotionally for me to do. I am not blaming anybody in this video. I am simply giving you information. I know it was dumb, okay? That's the whole point, so you guys don't make the same mistakes. This is the video that I wish existed before I got into bodybuilding. I also want to explain that I could not find pictures of me before I started steroids. I didn't start posting on social media until 2013, which is when I did my first show. My first cycle was before that. So my first cycle was not for a show. I didn't start officially bodybuilding and or competing until my second coach. So first coach, I was just obsessed with becoming hypermuscular, and that is where our story starts. My first cycle. I don't actually know what it was. My coach at the time put me on what he said was Anavar. Looking back now and knowing what I know now, I know that was not Anavar based off the symptoms, the fact that it was an injectable, and some of the side effects that I got from it. What he really gave me was either testosterone or tren. Trenbolone, also known as tren, which is more what I think it really was, is 5 times more androgenic than testosterone. It's known as one of the most powerful anabolics in bodybuilding. But looking back at my social media accounts, I did not start posting pictures until, like I said, 2013. This was before then, so I actually might have been around 21 years old. I am going based off memory, and I don't remember exactly the dose he had me on, but I think it was half a cc 2 or 3 times a week. He did tell me it was a new kind of Anavar that you could not find anywhere else, that it was super strong, this revolutionary, no side effects kind of drug, and then it was just gonna get me jacked. This is, again, not deflecting blame, it's just what happened, okay? This is relevant because this kind of stuff still happens today. Ultimately, it is the responsibility of the athletes to do their own research and to educate themselves. But when you're young, and in my case, dumb, you feel invincible, and that kind of combination can spell a recipe for disaster. And the reason I know this is still happening today was because, one, it happened to me again back in 2023. I had a coach, a high-level coach, approach me wanting to coach me and told me he was going to put me on tren. And he told me that the weight and the amounts and the dosages of tren that we were going to use would not cause me side effects. At this point, I knew better, and I did not use this person as a coach, but that is what he told me. And I still hear about it today in the industry. I hear about it in my gyms. I hear about it online. It's still prevalent everywhere. So to recap my first cycle, it was not for a show. There was no end goal. There was no structure. It was just the mindset of more is better. I wanted to get as muscular as quickly as possible, and he told me this is what you do, and I listened. And again, I will talk about why I had that mindset in a later video. The side effects happened very fast. The first thing I noticed was I felt like I had to clear my throat all the time, and I still kind of do that today. Then people started asking me if I had a cold. I was very small. I know I don't have pictures for you guys, but I was super, super skinny when I started this. I was under 100 pounds. I went from 100 pounds to quickly 118 pounds. My voice dropped fast, like fast, giving me crap for this enlargement of certain things. It was very intriguing to you guys. The clits, my clit got bigger. It also drastically increased my sex drive. Like, use your imagination, but it was very high. I also started to get pretty bad breakouts. Now, this wasn't anything like cystic acne like you would see, some of the stuff online. I never got that bad, but I was always used to clear skin, so it was definitely a drastic change for me. My face looked puffy. My breast tissue looked less full. And it was so long ago that it's hard to remember, but I'm sure I was having some anxiety at that point. So to recap on my first cycle, was most likely tren at 150 to 200 milligrams a week for about 17 weeks. And if I remember correctly, it took about 4 weeks for people to start noticing and questioning things. Well, one, I did gain a lot of muscle very quickly. And then obviously, my voice changed and things people started to notice. Side effects were voice, clitoral enlargement, high sex drive, acne, hair loss and growth on the body, water retention, possibly shutting off my own testosterone production, and I'll explain that later. Jumping into my next cycle was very different because at that point I decided to compete. I ended up moving away, thankfully, from my first coach, and I ended up going to a nutritionist who happened to be a prep coach. He was the first one to tell me about the stage. At this point, I still didn't know exactly what on-stage bodybuilding was. I knew there was bodybuilders, but I was pretty sheltered as a kid, and so I didn't know that there was actually competitions for bodybuilding. And this coach showed me that. He introduced me to it, and I decided to go all in with him. Now, my second coach put me on orals only. He had me on Winstrol at 10 milligrams a day. He also introduced me to diuretics, which we just used for show days, and T3. Winstrol is an oral steroid, and it's popular in the cutting phase. So it's not a great mass builder, but it's good for finishing is what they say. The diuretic that we used was called aldactazide, and that is a potassium-sparing diuretic. T3 is a synthetic thyroid hormone. It's used commonly in bodybuilding to increase metabolism, and it's often used during preps to help lose body fat. My very first show was in July of 2013, and I competed in the figure category. I ended up getting second place out of 30 girls, and at that point, I really felt like I had found my community. Even some of the judges came up to my posing coach afterwards, a separate coach from the one that was prepping me, and were asking about me and asking where I came from, and they actually ended up telling her I would have won had my posing been better. But that in itself was very addicting. I felt like I was in the right place. That show also qualified me for nationals, and my coach immediately started sponsoring me. I did nationals that same year on the same steroid cycle. I think we took a small break between when I qualified in nationals, but we got right back on after that. So when nationals came around, I actually ended up passing out backstage due to the diuretic usage. He had me take aldactazide again, which is the potassium-sparing diuretic, but he also had me cut my sodium. This is what caused me to pass out backstage. Actually, almost didn't let me go on. The side effects from that cycle, because I was already pretty virilized, meaning I had already experienced side effects, I didn't notice much physically. I did notice that I was having more depression issues. I did lose my period, but also my calories were super, super low at that point, and the diuretic could have killed me, plain and simple. So to recap on that second cycle, it was 10 milligrams of Winstrol a day, which comes out to 70 milligrams a week. And then I was on T3. I believe I got up to 30 or 35 micrograms, and then aldactazide. T3 and aldactazide are not androgenic. I then took a break from competing between the years of 2014 and 2016. I was still lifting, but I was no longer competing. In 2016, I got with my third coach, and he's probably the first one that I would consider a good coach. Before he let me do anything, he had me get blood work, which showed low T, low testosterone, and that was probably due to my previous cycles. And that's when I got with an endocrinologist for the first time. It also showed hypothyroidism, which was probably due to T3 abuse. My endocrinologist at the time prescribed me 8 milligrams of testosterone. I still remember my lab showing a 7 for my testosterone at the time. So they did give me HRT at that point. In addition to the 8 milligrams of testosterone per week, he put me on 15 milligrams of Anavar, and eventually we got to 50 milligrams a week of NPP. Anavar is one of the most commonly used oral steroids for women. It's known for promoting lean muscle mass. NPP is a fast-acting version of the compound nandrolone, which is commonly known as DECA. It promotes muscle growth as well as joint comfort. It can come with both androgenic and estrogenic side effects. My side effects for this cycle was I went from about 118 pounds to 130. Also keep in mind that my diet changed pretty drastically at that time too. I noticed maybe a little bit more hair loss. I did get my period back at this time, but my other side effects either remained or got a little bit worse. So to recap, I was on Anavar, 15 milligrams per day, which comes out to 105 per week. Testosterone was at 8 milligrams per week. And then eventually NPP came in at 50 milligrams per week. So the highest I went with this coach was 163 milligrams. We would cycle on and off Anavar, but I stayed on my test this whole time. I did several shows with this coach and I did pretty well, but the feedback from the judges kept coming back. They wanted me to come in bigger and leaner. And of course, me being me, I wanted to be bigger and leaner. So at that point, that is when we added the 50 milligrams of NPP per week, but the feedback was still to get bigger and leaner. What I really respected about this coach was he straight up told me he was not comfortable doing the things that he thought would be required to get me to where the judges wanted me. And he encouraged me to find another coach. Now, by this time, I had already had plenty of side effects and I pretty well knew what I was risking. At least I thought I did. So I started looking for coaches that were coaching women where I wanted to be, which was the Olympia stage. I ended up getting with a very well-known coach in the industry. He had tons of Olympians or people that had been to the Olympia, and he immediately gave me a huge discount when I signed with him. And I want to add a note here that most coaches have incentive to get their athletes as freaky as possible, especially the ones they see potential in. The more impressive you look, the better they look as a coach. Combine that with an athlete that's willing to do whatever it takes, and you can see why there's so many deaths in bodybuilding. And that's why sometimes, not all the time, but sometimes coaches giving you special treatment can be a red flag. And again, I'm going to cover that in a future video. So I started with this coach in 2019. I did my first show with him in October of 2019. This was my first cycle with him, my first cycle that I actually have in writing because we communicated over email. This was also the first coach that I used that was not in person, so everything was online. I also switched from the figure division to the physique division at this point. 16 weeks out, we started on 10 milligrams of Anavar per day, 50 milligrams of NPP twice a week. And then that went to Anavar increased at 8 weeks out, 15 milligrams daily. That's also when we added in Novadex every 12 hours. And that was at 10 milligrams. Novadex is often introduced in the final weeks leading up to a show because it helps tighten up the physique. At 4 weeks out, my Anavar increased to 20 milligrams daily. We started Winstrol at 10 milligrams daily, and I continued to use 20 milligrams of Novadex. He did have me on diuretics. He had me on aldactone at 25 milligram tablets and diazide at the same dosage. The diuretics were not used until a couple days out from the show. So from 16 weeks to 18 weeks out from my show, I was on 10 milligrams of Anavar a day, 50 milligrams of NPP twice a week, which comes out to 100 milligrams a week. That total was 170 milligrams a week of anabolic load. 8 to 4 weeks out, I was on Anavar at 15 milligrams a day, so 105 a week. NPP stayed the same, Novadex stayed the same. And then the final 4 weeks, I increased Anavar to 20 milligrams a day, which came out to 140 a week. Winstrol came in at 10 milligrams a day, so 70 a week. NPP stayed the same, Novadex stayed the same. He also had me on Clen and T3 at this time. Clen or clenbuterol, it's not an androgenic steroid. It increases metabolic rate by increasing temperature. The side effects from this cycle, I went from 130 pounds to 140. At this point, I had very noticeable hair loss. That's when I really started to notice it. I had loss of facial fat volume. I lost my period again. And my sex drive was dumb, like through the roof. My side effects were I went from 130 to 140 pounds, hair loss, loss of facial fat volume, loss of period, and sex drive was absolutely insane. I did come off all compounds in the off season after that cycle. I did end up winning my show. Then I believe COVID hit and I didn't compete again until 2021. And this next show, we decided to go full on into the bodybuilding category. Now, competing all kind of falls under the bodybuilding umbrella, but there's different categories under that. But we decided to go into the bodybuilding category per some of the judges' feedback from my last show, and also my lat spread being a very dominant pose for me, which is only in bodybuilding. And at this point, I was all in bodybuilding. I was making a living off of it. My whole life was dedicated to bodybuilding. Our next cycle was a lot more extreme than anything I had done before. We started out at 20 milligrams of Anavar per day, 10 milligrams of Winstrol a day, Remedex, which is another estrogen blocker, and Novadex starting at 8 weeks out. He also put me on some other injectables at this point, which was Primobolan at 200 milligrams a week and Mastron every third day. Primobolan is a DHT derivative. It does not aromatize, which means it does not convert to estrogen. Mastron is also a DHT derivative. It's most commonly used in the cutting phase. So my total weekly anabolic load was between orals, 210 milligrams between Anavar and Winstrol, and then between the injectables, Mastron and Primobolan was 325 milligrams, which brings the grand total to 535 milligrams. And for those who are well versed in PEDs, you are either cringing or you're not surprised. The side effects that I got from this cycle was I got up to 160 pounds. My hair was officially done. It looked nothing like it did before. I'm half Lebanese and half Italian, and it was totally, absolutely not the same. I've come to terms with it. I had bad anxiety, and my sex drive was just off the charts, insane, couldn't focus. You get it. So to recap, I had hair loss, acne, my voice dropped even more, hair growth, anxiety, loss of period, and crazy sex drive. And to recap that cycle, my Anavar was at 140 milligrams per week. Winstrol was at 70 milligrams per week. Novadex, not counting that as an androgenic, but Primobolan was 200 milligrams a week. Mastron was 50 milligrams every third day. So that roughly came out to 116 to 125 per week for a grand total of 535 milligrams per week. And this show, I missed my pro card by one placing. I'll add some pictures here. Into 2022 and 2023 was my prep for when I did get my pro card. We did the exact same cycle, except we added in Clen right away. So that comes out to, again, my orals were 210 milligrams a week. Injectables were 325 milligrams per week for a grand total of 535 milligrams. And then, of course, there was the Remedex, Novadex, Clen, and T3. The side effects stayed relatively the same. Now, this is where things changed a little bit for me. I decided I was not willing to do diuretics again. Even if that caused my coach at the time to not work with me, we had gone back and forth on me not wanting to do diuretics and him really wanting me to. This is also when I started training with a new training partner in the gym who was also a bodybuilder. And I'll put pictures. I don't know where I'm going to put pictures, like there, I don't know. They'll be somewhere. I was deep into prep when I decided to drop this coach due to the fact that he would not budge on the diuretics. I told him I didn't want to take them, and he was adamant that I take them, so I did end up dropping him. I had a brief period with a high level coach that wanted to coach me. He actually flew down to where I live to train with me. He offered to coach me for free. But ultimately, I didn't end up using him either because he wanted me on trend. Like, see, I'm getting smarter. And my training partner at this time saw all this firsthand, and he agreed to coach me for the last 8 to 10 weeks of this prep. We discussed my prior cycles. Of course, I had to disclose all the things that I was on at the time. And he asked me what I was willing to risk and, of course, what my goals were, which he was the first coach that actually asked me what I was really willing to risk. That cycle changed mid-prep to test at 24 milligrams a week, NPP at 30 milligrams a week, Primo at 60 milligrams a week, and then Anavar at 10 milligrams a day. So that came out to a total of 184 milligrams a week. He immediately dropped my Clen, Arimidex, Novadex, and cut my T3 back to 20 micrograms a day. I did end up getting my pro card this time around. After I got my pro card, I went into a 6-week health phase where I was just on test. And during that time, my coach at the time / training partner, we did start dating. And so we decided that it was probably better that I get another coach. So I started working with another very well-known coach who also had Olympians. I also want to note that all of these coaches were doing what I asked of them. I do wish that going into it, I had had more guidance and that coaches were more willing to educate on the risks. And of course, I wish I had done more research, but I just wanted to remind people that they were doing what I asked. And I know this probably seems like a lot to some of you guys, but I assure you this is not uncommon in this industry, even for women. I've spoken to tons of pros on very similar cycles. So here is my last full cycle, meaning more than just TRT. And I want to stress that TRT is not natural, it's still enhanced. But most people in the pro bodybuilding industry do not consider it an actual cycle. 210 milligrams a week, NPP at 60 milligrams a week, and test at 7 milligrams a week, totaling 277 milligrams. My side effects were my hair was thinner than ever at this point. I was getting regular breakouts. I had full-blown cystitis symptoms, meaning pain pretty often. I was having bad anxiety and depression, but I also want to note this point in my life, I did have a major life change as well as my father passing away, so that could have contributed. I got my labs done in the middle of this cycle and it showed my estrogen at sub 15, which is so low for a female. I have gotten my labs done consistently ever since 2016 and my estrogen had never been that low before. But looking back, I can definitely see the downward trajectory that it was going. My cystitis pain became unbearable at that point. I did hours of research trying to find a connection between steroids and cystitis. I talked to other pros and it turns out that there is a correlation between steroid use and cystitis. The cystitis that I experienced last year and I'm still currently dealing with, she's been dealing with it for a couple years. It was just that nobody was really talking about it. In fact, I was talking to another pro and they were telling me about all their symptoms they were having, but they were still posting online for their sponsors. And that's not a dig, I completely understand that. It just goes to show the reality of this person was really struggling with the symptoms that they were having, but they were acting like everything was fine on social media. So when you see your favorite fitness influencer posting about their perfect life online, just realize that's not always the case. There can be a lot going on behind the scenes that they're not talking about. At this point, I did end up seeing a urologist who did a bunch of tests. They ruled out anything bacterial or structural that could have been causing my pain. I was honest with him about my PED use and he yelled at me, but helped me ultimately. He theorized that exposure to androgens over time caused thinning of the lining of my bladder, and that's why I was having pain and inflammation. Now, this of all things is what stopped my PED use completely, and that includes testosterone. I did stop testosterone for a time until it actually got too low and I started experiencing some depressive symptoms. Yes, testosterone can be too low in women, that's a thing. But this leads me to now, where I am now. I am back with the coach that got me my pro card, the one that was also my training partner. I've been off everything except for TRT for about 8 months now. So right now I am currently on 16 milligrams of testosterone per week, and it is being monitored by a doctor. My side effects, I don't notice any worsening side effects at this point. I have gotten my period back and it's been consistent for months now. I've softened up quite a lot, as you can see here. I'm definitely quite a bit softer and smaller than I was when I was running full cycles. The side effects that I have managed to correct partially or fully, I have had laser hair removal all over my body, basically from like here down. It's been really nice. I'm super smooth. Hair has improved some. You can kind of see like the wispies that are growing back. My cystitis symptoms are almost completely gone. I still have what I call flare-ups when I eat something like spicy, and I'm guessing that's because of inflammation. I've had a nose job, but that wasn't due to bodybuilding. It was because I had a big Arabic nose and I didn't like it. But one of the side effects from steroid use can be cartilage growth. So if I still had that cartilage there, I don't know what it would look like. Effects that I probably will never be able to reverse, obviously my voice. I can maybe get some improvement on it. Like I've said in a past video, I do have the option to do vocal training, but I've not started yet, so there's no improvement as of this time. Another side effect I will not be able to reverse without surgery would be the clitoral enlargement, which, if I'm being honest, that's probably the only side effect I would actually choose to keep if it was up to me. Look, don't be fucking weird in the comments, okay? It is what it is. But I probably will have to be on HRT for the rest of my life. If I go off testosterone, my natural testosterone drops, it bottoms out, and I start feeling like I'm depressed. And I'll also probably have to be on thyroid medication for the rest of my life. So going forward, I want to make this super clear. I created this channel on transparency, and that means truth, even if it's going to piss you guys off. I do plan to keep bodybuilding, but I will never go back to the high dosages that I've used in the past. And I will never take diuretics again. But I do want to keep bodybuilding for as long as I can. This is a side note, but I actually am really excited about Lee Haney's new organization, if anyone is familiar with that. He's built it off of rewarding shape over size, so I would be really curious as to how I stack up in that kind of organization, but that's just a side note. I do plan to lean into things like HGH, which does not come without risks, but it doesn't come with the risk of androgenic effects, because I still have this deep desire or addiction or whatever you want to call it. I didn't create this channel to shame PED use or announce my retirement. I did it so you guys could get a real picture of what this kind of stuff looks like. In doing that, please realize that I had to fully remove my ego and any fear that I might have of being judged for this. Now, my other thoughts and / experiences with this kind of stuff is if you research these compounds, what it looks like on paper doesn't always necessarily apply to application. Meaning their effects on paper, like what you research, can be different in practice. Not only from my personal experience, but from talking to other people in the industry as well. The side effects that I've experienced can be vastly different from the next person taking the exact same thing. I've been absolutely lucky in the fact that this stuff has not affected my heart, because for so many people it does. I do go to a cardiologist, and I got a full workup earlier this year after my dad passed, and there was no enlargement. I told him that I've taken gear. I've told him for how long I've taken it for. He, of course, was not happy and told me there was serious risks. But after all of his tests, stress tests, EKGs, calcium scores, all this stuff, I was completely cleared. So I consider myself extremely lucky in that sense. I do know people that have not been so lucky. I also wanted to make sure you guys know that bodybuilding and weight training alone do not cause these type of side effects. I know some of you asked that in the comments, so bodybuilding alone is not going to cause these kind of things. Bodybuilding can be healthy as long as you do it as a natural. And this might anger some people, but this is my opinion after being in the industry for this long. You cannot bodybuild at a competitive level without at least some type of steroid usage. And you cannot use steroids without there being some type of side effect. Unless you have the craziest genetics known to man, you are not going to get far in competitive bodybuilding as a natural. Now, what I would have done differently knowing what I know now, number one would be learn to train and learn to train for hypertrophy. Number two is learn how to eat and manage stress. 3, I would find a coach who is truly knowledgeable about PEDs and health. 4, I would decide what risks I was willing to take and what risks I was willing to not take. 5, I would have gotten blood work before I ever touched a PED. And only then would I introduce secondary compounds. And even then, it would have been in the forms of HGH and possibly SORM. I would have considered HRT to get me the upper normal limits, and I would have constantly monitored my health and side effects and not been in denial about them. I will be covering a in-depth is bodybuilding right for you video in the future, as well as the other videos that I plan to make. But that's about it for this one. I hope this helped you guys. I know it was absolutely insane. Some of you are cringing. Some of you probably don't know what to think. And then there's probably a few of you that aren't really surprised if you know the industry well. But that's all for me today. I hope this helps somebody. I hope this clears some things up. And I will see you guys in the next video. Bye.